Hi guys, in this video I want to differentiate between a canker sore and a cold sore. Okay, they're not the same thing. A canker sore is a little white or yellow ulcer on the inside of the lip or on the inside of the mouth. A cold sore is an actual little ulcer or bump or pustule sac on the lip or around the mouth. Okay, the cold sore is viral. It's a virus. A canker sore is a nutritional deficiency of B12 and folate. These are B vitamins. This is a virus, herpes simplex. You cannot kill a virus because it's not alive in the first place. So all you can do is keep it in remission, and it just hangs out in the same location all the time, like right at a certain part of your lip, and it just kicks out under stress. Stress will activate the virus. Okay, also nutritional deficiencies. So when you go through some type of stressful event, boom, it comes out and you get a cold sore, okay? A cold sore is contagious, all right, for about 10 days. A canker sore is not because it's a vitamin deficiency. You get a canker sore by consuming refined grains and refined foods like breads and pastas and cereals and crackers and biscuits and waffles, pancakes, right? Also, it could come from a digestion problem. Let's say you had an antibiotic or you have, I don't know, irritable bowel syndrome or chronic inflammation in your gut, leaky gut, all that. And then that could be why you're not absorbing B12 or folate or other B vitamins. Okay, that's another cause. But it's non-contagious. I'm going to recommend for a canker sore just to clean up your diet and don't consume any more refined grains. Also, take nutritional yeast. That would help this greatly, okay? In a cold sore, what you have to do is you could speed up the cycle of the virus by taking lysine, which is an amino acid, and vitamin C. Make sure the vitamin C is a food-based complex, not a synthetic, all right? Thanks for watching. Forget it, I'm done. Press the subscribe button and I will keep you updated on the future events.